Our final presentation comes from Dr. Edgar José Velásquez Orellana, a doctor of gynecology and obstetric in Honduras. He'll discuss BabyChecker in the Honduran communities and share how the solution is helping clinicians detect complications earlier and improve outcomes for mothers and babies. Dr. Edgar, the floor is yours.
Good morning, everybody. Welcome. For me, it's a pleasure to be here sharing this experience with BabyChecker in Honduras with all of you. So to start with, I want to confirm what previous people were saying. BabyChecker is an AI tool that is designed to do these ultrasound scans without having to deal with professionals, like people who really know about this. We need to go deeper into this point because I think this is one of the best advantages of this, because training, as was mentioned before, training is very basic, very easy. Any person that has that can do this training, which is very short and easy, can use this device. And the advantages are many. In Honduras, the idea is to reduce the mortality, especially in faraway areas, rural areas, and people that have low income, low resources. We have to take into account that maternal problems with deaths have to do, of course, with income, and the social impacts of this aspect are many, and it also has to do with with problems with education, with so many things. So it's a very complex problem that involves many aspects of life. Next slide, please. In Honduras, as was previously mentioned, we are facing high numbers of mortality for mothers, especially this is because of the lack of access to healthcare. The pandemic had a very strong impact, especially in patients that were attending the healthcare clinics, because they were looking for this access of health service and self-care. And during the pandemic, a lot of institutes and clinics were closed. So these women who were having risks in their pregnancies and could not access this medical care because the clinics were closed, they had to face a lot of problems, and therefore there was an increase in mortality in this aspect. It meant that the number increased from 61 to 125 deaths for every 100 births. And also, another thing is that in these rural or faraway areas, technology is something that it's lacking. Some areas don't even have energy or internet access. The roads are also not very good, so these are very hard to reach areas. So the quality of the healthcare services there are greatly affected by all of this. So this device, this tool, BabyChecker, came as a help for this so that we can provide better healthcare. Next slide. In September 2023, for the implementation of BabyChecker in Honduras, we reached an agreement with the Health Secretariat, with the WHO, and we agreed on some things, that we were going to use the BabyChecker. We were going to use 5 in hospitals and rural clinics. In the hospitals that we used, these BabyCheckers were in the hospital Tegucigalpa, in hospital Mario Catarino, and also, as I mentioned, in some rural clinics, which, as I was explaining before, these areas are very hard to reach, and where the use of this device was very needed. It's very important to say that the impact of BabyChecker showed the importance, the positive impact. Like, of course, the impact is greater and better in rural areas. So it's very important to say that when getting these devices, it's a crucial point to consider where are we going to allocate this, whether the staff is trained to do the ultrasounds or not, whether they have the technology or not. BabyChecker, I mean, if they have all of these other things, BabyChecker is not that needed. So that's why we mainly allocate BabyChecker in rural areas where they really don't have other devices and where people are not that specialized. So I want to insist on this. It's very important to take into account where we are putting the BabyCheckers. Next slide. So the use of BabyChecker. Back then, we used BabyChecker in October 2024, approximately 1 year ago. We had like a baseline, so we could assess the implementation of this device so that the health secretariat can make the decision to integrate this in the birth technologies that we were using for pregnant women. And we started with this baseline last year. We assessed around 400 women in 3 different region areas, the south of Honduras, La Paz, and the center of Honduras, that apart from being rural areas, they also have a high percentage of different ethnicities, local ethnicities, and this has a positive impact on these people. The nurses and the people that were volunteering in the healthcare services and were able to take the training to use a BabyChecker, they were very happy with the results. They were able to collect the information. So basically, the idea of the BabyChecker is to find out about the gestational age, multiple pregnancies, the positions of risk, and the alert signs that we can find in these cases. Next slide. And then the impact in the community, well, honestly, as I was saying at the beginning, the training for the BabyChecker is very short, so it allows not specialized staff to use this tool and obtaining very important information to find, like in a timely manner, risk factors, and therefore refer this patient to a specific health institution where she can get the proper care. It is also very important to say that this improves the access to birth care services in areas that are extremely far away, indigenous areas. This is a very big barrier. In our country, we have a lot of different ethnicities, and given cultural differences, some people don't even want to be attended or cared by specific ethnicity. So this breaks these barriers and allows us to bring technology to these areas that otherwise wouldn't have it. And also, detection at a timely manner allows us to act with more options to refer patients where needed, and that helps too. Next slide. Okay, future outcomes or future ideas. It's very important to assess or evaluate this pilot project. We presented a report to the health area in our country, and the idea is that they can take a look at this, and we gave them this information report so they can analyze and decide if they are going to expand this in the future, mainly the use of the BabyChecker, especially in the rural areas that, as I mentioned, the people who do the pre-birth controls don't have technology or don't have the necessary technology to provide or help and bring a greater impact in this matter. And one of the objectives for the future is to expand the use of this technology in other regions, to train more people in the use of BabyCheckers so that we can have an impact to decrease this type of problems. And here we have a Lenca woman that when doing the test, the assessment, she was pregnant, and she was carrying her other child on her back. This is a very typical way of carrying babies in this part of the city. As you can see, this is very humble people that are exposed to a lot of risk. So our goal is to save these women and to help them in their care. And BabyChecker was a crucial part of this. Thank you.